Hey everyone, welcome back to Forward Therapy. My name is Kelly Troutman and I'm a certified hand therapist. And today is going to be a splinting video. So, I don't know, some of you have emailed me for some of my favorite splint patterns, and I thought it might be fun to show you how to actually make the splint because I don't know about you guys. When I look at a pattern like this, for instance, which this is actually my absolute 100% favorite short opponents splint, my hand-based thumb spica. That's my favorite one to make. And when I look at this, I have no idea how it's supposed to go on a hand. So sorry if there's background noise. I'm heating up water for my make at home splint pan, um, which is a bowl of hot water. And yeah, so I don't know. I thought that this might be a helpful video and you guys can let me know. So just to give you an idea of what this splint pattern is going to look like, I'm going to split my left hand. So I have it oriented in that plane right now. So this back side here is going to go on the dorsum of the hand. And then, you've got kind of your wrist right here, this area. And then this piece right here is going to wrap underneath the thumb and connect around the back. So this is going to really hug that CMC and MCP joint really, really nicely. It's a low profile splint. Patients tend to really like it. It tends to be fairly comfortable for them. I'm using just a scrap piece. So I'm using 1/8 of preferred. This is not sponsored, by the way, just a material that I like. But this is just a scrap piece. I don't always use 1/8. I actually think for a lot of people, the 332 is a little more comfortable, but just depends on what you have. I've used other materials as well. So what I like to do is just have my patient rest their hand on the table in front of them, and I'll just bring their thumb into kind of this halfway between radial and palmar abducted position. Our material is ready. So forgive me guys, splinting one-handed is always interesting. So forgive me if it's a little shaky or wonky or anything. But okay, so here we go. Here's our little piece. This guy is going to go over the dorsum of the hand. Line up your wrist. This curvature goes around the thenar eminence. And then let's see if I can do this one-handed. Gosh, this is really horrible. But anyway, you get the idea, right? So again, you've got this piece coming around the back, supporting the MCP joint. Then what I like to do is come in and support their CMC and MCP. And what I'll usually do is have the patient just make a loose uh, thumbs up sign. Sorry, okay sign. Wow, my brain is not working. And you want to contour that dorsal piece around the back. You can always roll these edges back if they are sharp or bothersome. But again, I just like to kind of hold and support under that MCP joint, especially if they tend to sublux or if they tend to collapse at all. And just kind of smoothing out that material. So that's kind of what this guy will look like. It's still a little bit warm, but I think you guys can kind of get the idea of what that looks like. Probably would make this a little bit narrower. There we go. That's better. And then Velcro, in terms of Velcro, usually I'll trim this back just a little bit and make sure that their wrist is free. So I would cut this part off a little bit as well. And then Velcro, I'm going to put one piece right about here. The Velcro piece is going to attach kind of around the wrist here. And then one piece about here. And you might want to angle it just so that it's not cutting across their hand. So again, one piece here, one piece here. And then you're done. It's a really simple splint. It fits really nicely. Most people think that it's very comfortable and they find that they can be really functional with it. Yeah.